Hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. In today's YouTube session, we'll study about various very important must-know clinical case scenarios, and in the form of MCQs, we'll discuss them. And this is very important, and you should do a lot of practice of these type of questions because these are the newer trend questions, and these questions are basically very easy, very conceptual, and it makes the paper easy in terms that you have to now only do the conceptual things. You don't have to mug up bahut zyada, but the only thing is that you have to read such questions very carefully, see the images, and mark on the important things that are given. And very importantly, you need to have a speed so that the time management can be done during the paper. So isliye the practice is very important in before the examination. So I will be taking a lots and lots of these questions, and this session is extremely important for the FMG aspirants. The examination is due next year, sorry, next month only, and the NEET PG 2022 aspirants also. This is very important because you should practice, and this is a way which will generate your interest towards the studies also. So it is will be a very interesting session also. Okay, so currently I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. And I am here for your subject of orthopedic, and we'll study in-depth orthopedics and concept-based orthopedics, so that you can not only crack your NEET PG, INICT, FMG like competitive examinations, but also you can do well in your prof university examinations, okay, and practical examinations. So before starting the session, I will just briefly guide you about a various subscription plans that are available for the NEET PG on an academy. The first one is your plus subscription. In plus subscription, the subscribers sorry, the subscribers will get access to all our live as well as recorded classes. They can access our entire QBank, and they can compete in live tests and quizzes, all of which is found by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to log into multiple devices with the same account, so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we are shortly providing them with a printed notes. And while subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one and the best one is your iconic subscription, and this is best not only on the Unacademy but across any digital platform for the NEET PG in India. And what makes this best is that apart from the things that I've told you earlier, that means plus subscription ki all of the things you will get in iconic subscription. Extra may you will get the prep ladder, and all of the prep ladder including its entire Q bank, the video lectures, rapid revision courses, grand test, etc., everything. And on an academy extra me you will get live, well structured batch wise classes, and we have formulated our batches and structured a course in such a way so as to build up your basic concept about any subject or topic first, then going into its in depth. And we will have special focus in our classes on such clinical based scenario questions, the images, flow chart, match the column, type of interesting and easy learning, so that you can make your concepts very well and you can remember them also. And also after every test that you'll give, the iconic subscribers will get an individual test assessment sheet where you can analyze yourselves. You can analyze, yes, this topic or this subject needs more revision, what are the things that I need to revise more, or kiss type of questions are framed, what are the things that are asked more frequently. All of this is very important. And while subscribing for the iconic subscription, you can use my code, that is Anshul B10, to get extra 10% off. Special classes are very special. They give you extra edge over your competitors, and what makes them special is that They will give you live classroom like feeling where you can interact with your educator in the live class. You can participate in polls, clear your doubts there and there only, and you can watch this class anywhere, anytime. You have to just download the mobile application of the Unacademy and log in into this application using my code, that is Anshul B10, and both of which are absolutely free. And also, after every special class that you will attend, you will be provided with a printed notes. A QBank is very effective because it contains every type of question. It will cover your entire theory, and every pattern of question is included in a QBank. The match the column type of questions, image based, recall previous years MCQs, the X-ray, CT image, MRI based, the histopathological slide based, and the recent advances is very important. These clinical case scenarios or clinical cases based questions all are included, and question practice is the best way to revise and the best way to prepare for any competitive examination. And we have also launched a new feature which is called as raise a hand feature to make our live classes more interactive, to increase the communication between the learners and the educators. So in this you just need to tap on a button so that you can digitally raise your hand, so that the educator will come to know about your doubt, and you can solve your doubt and discuss your queries there and there only. And also, till 1st of the December, we are running a limited time period of a great opportunity for you, where if you'll buy for any subscription plan of 2 years, 4 months of that extra may you will get absolutely free. Similarly, for 12 months of 1 year, 2 month extra may absolutely free. And in 6 months के subscription plan में 1 month of that subscription plan you will get absolutely free as an add-on. And also, if while subscribing, if you will use my code, that is Anshul B10, then you will get extra 10% off also. So it is a great deal. Please do subscribe for it. And here are the various subscription plans of our iconic as well as the plus subscription. And here you can see that the cost per month decreases significantly if you increase the duration of your course. So economically अच्छा है, and academically also you should have a single source of information from the starting of your preparation. Okay, so please do subscribe for subscription package with longer duration. And while subscribing, you can use my code, that is Anshul B10, to get extra 10% off. Okay, so let's start today's session. After every question, I'll give you appropriate time so that you can read the question and options very carefully. Then mark your answer and type that in the chat box. Okay, so the first question is, a 60-year-old man has intermittent pain in his right great toe for the past 2 years. The most likely cause for the lesions shown in the x-ray is, here are your 30 seconds. Okay, so 60-year-old man, intermittent pain, right great toe, past 2 years say the lesion, there is complete destruction of the great toe, the great metatarsophalangeal joint. Okay, lytic lesion, destructive lesion is there. So all these history in great toe aane se, all these history favors the gout. Okay, it is gout. So great to aate hi gout. Okay, and in gout you have the deposition of the monosodium or the bisodium urate crystals. Okay, so this is your answer. Remember, gout में urate crystals deposit होंगे, सोडियम के अलावा पोटेशियम सॉल्ट्स एक्सेट्रा सॉल्ट्स के फॉर्म में भी हो सकते हैं, बट नेवर इन द कैल्शियम और फॉस्फोरस सॉल्ट्स. सिमिलरली सूडो गाउट में it is pyrophosphate deposition, but it can be in the form of calcium pyrophosphate. form. Okay, so the answer will be your monosodium urate crystal deposition in the gout. Okay, so gout is basically a inflammatory arthritis due to a defect in the purine nucleic acid metabolism. Okay, so there is accumulation of uric acid. So this increased accumulated uric acid is deposited in the form of urate crystals, and it starts from the great toe. Okay, there's formation of toffee, etc. Okay, so most common joint we have seen in olecranon. The most common bursa affected is olecranon bursa. Toffee formation hota hai, and NSAIDs, uricosuric, uric acid inhibitors, allopurinol, etc. are used. So just go and take out your pharma notes, read about these drugs. It will take just 5 minutes. Okay, so it is the best way to revise. This is your pseudo gout. Okay, so pseudo gout में क्या होता है? First of all, there is deposition of sodium or calcium pyrophosphate crystals, and most commonly it involves the knee joint. And knee joint में भी किसको? The menisci are involved most frequently the meniscus are involved. So there is calcification of the meniscus. This is your pseudo gout. Okay, so the crystals are needle like in gout, whereas rhomboid. Okay, and knee joint here affected in pseudo gout. Great to hear. Radiography में there will be red bite erosions. Okay, and यहाँ पे there will be calcification of the meniscus, which is called as the white lines of chondrocalcinosis. Here you can see very easily the white lines of chondrocalcinosis. Okay, and birefringer, it is negatively birefringent, whereas it is weakly positive birefringent. Elderly pseudo gout more than 60 years में होता है generally. Large joints, knee joints are affected. As compared to gout and pseudo gout, gout is more severe in terms of pain and swelling. Okay, because they are more destructive lesions, the red bite lesion. Okay, so this is the difference between gout and pseudo gout, very important. Now we'll come to the next question. Next question is, a 33-year-old man with history of IV drug abuse presents with lower backache with increasing intensity. Neurological examination is intact. Laboratory studies reveal a WBC count of 11,000 and ESR of 82. Blood cultures negative. Plain radiographs are shown. Initial management should consist of. So here are your 30 seconds. Okay, so a 33-year-old man, IV drug abuse means more chances of infective pathology, lower backache, neurologically intact है, WBC count and ESR are raised, blood culture negative. Okay, and here you can see there is one destructive lesion here in the vertebral body and in the X-ray also. So neurologically intact है, इसलिए physical therapy and supportive therapy, initial management, yes ये तो देंगे ही, but it can't be the answer. सारे options पढ़ते हैं. IV antibiotics, yes, it's looking like an infective pathology. Okay, so ये तो पक्की बात है कि there is an infective pathology. Open surgical decompression not done because neurologically intact है. CT guided biopsy, yes, it can be done. अब इन तीन में से just physical therapy with support therapy will not be the choice. Okay, you have to diagnose it and do something. So either you start the IV antibiotics, yeah, you go for the CT guided biopsy. So first we will go for the CT guided biopsy to differentiate whether it is a tubercular type or any chronic infective pathology or a acute infective pathology, क्योंकि बहुत ज़्यादा acute infection अभी है नहीं, because WBC count are also not that raised and there is no fever etc. So the next in management of choice will be your CT guided biopsy. Remember this, it will be a CT guided biopsy. In arthritis or osteomyelitis acute conditions में never start IV antibiotics before taking the sample for the culture sensitivity etc, because even 1 or 2 doses of the IV antibiotics will make the culture sterile, and you will not be able to find the pathogen. Okay, so very importantly, that's why we are going for the CT guided biopsy. So the clinical presentation is pyogenic and or other any other infective vertebral osteomyelitis. Okay, so the next step is management. In management is to identify the organism. Okay, mostly seen in elderly population, especially in the IV drug abusers and the diabetes, and most common pathogen is your staph aureus. Okay, the most common pathogen is your staph aureus. Okay, so we have discussed all of this. Now this is your next question. A 10-month-old child fell off the couch and has left elbow pain, swelling. Radiograph is shown. All of the following are characteristics of this injury except. So here are your 30 seconds. Okay, so in the x-ray you can see that it is basically a elbow dislocation. So in children it is due to transphyseal dislocation of the humerus. Okay, there is a epiphyseal injury. So high risk of tardy ulnar which of the following is characteristic except. So high risk of tardy ulnar palsy, so generally there is no risk of tardy ulnar palsy. The tardy ulnar palsy is in the malunited lateral condyle fracture of the humerus. Posterior medial displacement is there, yes. High association with child abuse, yes, it is a characteristic feature. And high risk of cubitus varus deformity, yes, here there is high risk of cubitus varus deformity. So the answer will be A, that tardy ulnar nerve palsy is not the characteristic feature of this injury, which is the transphyseal fracture or the distal humerus physeal separation. Okay, चाइल्ड अब्यूज में बहुत कॉमन होती है. ओके, एंड इट अपीयर्स लाइक एन एल्बो डिसलोकेशन because secondary ossification centers has not yet developed. Okay, so this was about this question. Now we'll come to the next question, and the next question is this: 13-year-old boy with history of trivial trauma. Here are your 30 seconds. Okay, so here you can see that there is a lytic lesion, a tumor lesion in the proximal humerus with a pathological fracture. Okay, tumor lesion with पैथोलॉजिकल फ्रैक्चर. तो fibrous dysplasia नहीं है, giant cell tumor भी नहीं है. So either it is you will be confused between unicameral, also called as the simple bone cyst, or the aneurysmal bone cyst. So it is unicameral bone cyst, because aneurysmal bone cyst may there will be more loculated appearance, okay, and more wide. And here you can see a characteristic feature of this simple bone cyst or the unicameral bone cyst, that is your fallen fragment sign, okay. जो pathological fracture हो जाता है, this is your fallen fragment sign, which is the characteristic feature of the simple or unicameral bone cyst, okay. This is a unicameral bone cyst with pathological fracture, okay. Now next question, read the question you carefully first, then we'll discuss it. That's why I'm giving you 60 seconds for this question, okay. Okay, so there is a 12-year-old boy brought to the hospital by his mother because he had had intermittent pain in the right hip during the past 2 weeks. Okay, the patient ambulates, that is walks with difficulty. There is no history of fever, chills, malaise, recent illness or trauma. Patient is obese but otherwise healthy. Vague pain in the groin is elicited on the range of motion of the right hip. The most appropriate next step is X-ray studies to rule out which of the following conditions. Means what is the most appropriate diagnosis. Okay, so 12-year-old boy, obese, with no history of fever, chills, malaise, recent entry और हिस्ट्री और ट्रॉमा, यानी कोई भी इन्फेक्टिव पैथोलॉजी नहीं होगी, ना ही कोई ट्रॉमा होगा लाइक टीयर ऑफ द लैब्रम, ओके. नाउ देयर इज रेंज ऑफ मोशंस आर प्रेजेंट, नो ट्रॉमा हिस्ट्री, ओके. सो femoral acetabular impingement syndrome or capital femoral epiphyseal. So here it is generally a bursitis, इसको एक तरीके का bursitis होता है. So the uh, diagnosis is of the slipped capital femoral epiphysis, because 12-year-old obese boy के अंदर all these features है ना, limping, difficulty in walking and pain, okay, these features are of this slipped capital femoral epiphysis. And नाम से पता चल रहा होगा, what happens is that there is the epiphyseal injury, जिसमें the growth plate और the physis के ऊपर there is slippage of the epiphysis, that is the femoral head, in respect to the rest of the femur, okay. You can see in the x-ray here, okay. See, this is your slipped capitofemoral epiphysis, you can now very easily appreciate, okay. So it is basically a disorder in the adolescent 10 to 15 year of the age group का होता है, जिसमें the physis or the growth plate is damaged and the femoral head moves or slips with rest of the femur, that as I have told you, okay. So the treatment of choice is your percutaneous pinning by the Moore's pin, etc. Okay, so percutaneous pin fixation, Moore's pin, or this is called as CRIF, that is close reduction internal fixation, and then maintaining it in the traction. And if there are high risk of contralateral SCFC, that is if the age is less than 10 years, obese है, or there is some endocrine disorder, so there is high risk of this happening in the opposite hip joint also. So contralateral pinning is also done. And most important and the greatest risk factor is your obesity, and most common presentation is your thigh pain and groin pain with difficulty in walking, that is limping, etc. Okay, so this is your slipped cutaneous slipped capitofemoral epiphysis. And सिर्फ आपको इतना सा याद रखना है that loader classification is used for this disease. Okay, and it is an unstable injury. Okay, and physis is involved, so it is an very important disease to treat, otherwise there will be shortening, retarded growth, or cessation of the growth of this hip joint. uh, so it is a very important disease. Okay, now next question, इसको read आराम से, and I'm giving you 60 seconds, then we'll discuss it. Okay, so uh, there is a 19-year-old man, long distance runner, is referred by his primary care provider because he has a dull aching pain in the right thigh after running during the past 9 months. Any chronic etiology है. 6 months ago, the patient's primary care provider prescribed ibuprofen, that is NSAID, which relieves the pain only temporarily. The patient has no history of any specific injury. Physical examination shows no abnormality of the right lower extremity. X-rays of the right femur shows cortical thickening of the distal one-third or the shaft with a central nidus approximately 8 mm in diameter. Okay, which is the most likely diagnosis. Okay, so a cortical thickening yani sclerosis with central nidus. Okay, all this picture is a benign tumor, either osteoid osteoma or osteoblastoma. Okay, this is the typical x-ray presentation. Okay, इससे ऊपर का सबके अंदर कॉमन हिस्ट्री भी हो सकती है, because almost everything sorry every tumor that is in the options presents like this. Okay, so either osteoblastoma or osteoid because both have the similar x-ray presentation, that is sclerotic margin with a central nidus. Now it depends on the size of the central nidus, whether it is osteoid osteoma or osteoblastoma. So if it is less than 1 centimeter or less than 10 mm, then it is osteoid osteoma. And if it is more than 10 mm, that is more than 1 centimeter, then it is osteoblastoma. Okay, remember this. This is the criteria that we use. So the answer for this question will be E, that is your osteoid osteoma. Okay. This is your osteoid osteoma, sclerotic margin with a central nidus. Okay, sclerotic margins with a central nidus. This is your central nidus. Okay, this is your central nidus, and this here, this is your sclerotic margin, osteoid osteoma. Okay, less than 1 centimeter होगा. Okay, needles may sometimes there can be some calcium. Okay, but don't get confused, it will be translucent only. This is your bone scan. Okay, this is your aneurysmal bone cyst. Okay, a expansile eccentric septate metaphyseal होगा. And here you can see large lytic lesion with periosteal new bone. This is your aneurysmal bone cyst. Okay, see, this is your chondroblastoma, where there will be this dot calcification. Okay, and on histopathological examination it is seen like wire chicken wire appearance. Okay, it looks like chicken wire appearance, and also there is scattered giant cells in chondroblastoma. Okay, this is osteochondroma pedunculated type. Okay, now next question is this. I'll give you again 60 seconds, then we'll discuss it. Okay, so presented to the trauma with obvious deformity of the right femur and left forearm, intubated in the trauma bay, both the injuries were closed. How would you manage? So this is fracture shaft of femur, and this is your fracture both bone forearm, both are closed. Okay, so external fixation nahi hoga, internal fixation hoga. And treatment of choice here is interlocking nail femur, that is ILN femur. And here the treatment of choice is plating of radius and ulnar bone both. So this is your CRIF, that is close reduction internal fixation, and this is your ORIF, that is open reduction and internal fixation. Okay, so the answer will be femur में scriff and forearm में ORIF, so the answer will be D. Okay, so the answer will be D. So let us discuss some very important सर्जिकल ट्रीटमेंट ऑफ चॉइस. ओके, सो अगर सिर्फ सर्जरी इन एडल्ट बात करें, ओके, सर्जरी इन एडल्ट एज ग्रुप, okay, then starting from the humerus, so proximal humerus or shaft of humerus. Okay, so the treatment of choice will be plating, and plating is your ORIF. Whereas elbow में it is plating again. Forearm bone में it is plating, that is ORIF. Now Colles, Smith, etc. इनमें you can either go for JES, that is external fixator, or plating, that is volar plating. For scaphoid, either conservative or a ORIF with Herbert screw. Okay, ORIF with Herbert screw. And in case of any phalange fracture, you go for the K wires. Okay, now we'll come to the femur. Femur में सबसे important neck of femur. Neck of femur में if it is young adult, Then you go for the corticocancellous screw or the dynamic hip screw. If it is of the elderly population, then you go for the bipolar hemi arthroplasty. And if it is fracture of IT femur, then you go for the proximal femur nailing. It is different from the normal interlocking nail of the femur. It is a alag type ki nail, so this is called as your proximal femur nail. And for the shaft of femur, you go for the ILN femur. Then for the distal femur or proximal tibia intra-articular, you go for the plating, that is ORIF, and interlocking nail and PFN both are your CRIF. And for tibia, you go for the island tibia, again CRIF. Okay, and for patella, olecranon, and your medial malleoli, you go for tension band wiring, that is TBW. Okay, remember this thing. This is basically the surgical treatment of choice that we use in majority of the fractures. Okay, now next question. Again, I'll give you 60 seconds, then we'll discuss this question. Okay, so let's discuss this question. A 34-year-old female complaining of left leg pain after she was struck by a moving vehicle. She denies pain elsewhere. 3 into 5 centimeter open wound about the medial aspect of the leg, left leg with exposed bone. Otherwise skin intact. Compartments are soft and compressible, yani there is no compartment syndrome. She has appropriate pain with passive range of motion of the toes and ankle. Motor sensory intact and palpable dorsalis pedis and posterior tibial pulse. Any neurovascular injury is not there. Brisk capillary refill in all 5 toes. Which type of treatment would you do? This is your wound, this is your fracture. Fracture is of almost shaft of the tibia bone fracture with, so the diagnosis is open or compound fracture tibia. Okay, and bone exposing wound है, यानी it is Gustilo Anderson type 3. Okay, so conservative you cannot do, or if plating you cannot do, because or if say there will be more chances of infection because you will give the incision open the fracture side. KY you will not do. So the treatment of choice here is your island tibia because it is close reduction internal fixation with no incision or opening of the fracture site or at the wound side. Okay, so basically it should be debridement with island tibia. अगर यहाँ पे ऑप्शन में एक्सटर्नल फिक्सेटर भी होता तो then what you have done. Okay, so basically दोनों में से जो भी करते that would have been dependent on the surgeon's choice because both are good. तो ऐसे क्वेश्चन तो नहीं आएंगे. That's why external fixator was not given in the option. Okay, so this was this question, and इसमें you need to remember the Gustilo Anderson classification, which is used for the wound management. Okay, wounds are classified into 3 parts: 1, 2 and 3, and third is also in 3 types, A, B and C. Okay, now type A में there will be only abrasion or puncture wound etc. Not any lacerated wound जिस पे you need to have suture or any contaminated wound. Here there will be lacerated wound less than 2 centimeter and clean lacerated wound. Here the lacerated wound will be large, contaminated. Here उससे भी large होगा with bone exposing, and here there will be neurovascular injury. Okay, remember. Okay, it is the worst prognosis and the most emergency condition. Okay, this is your Gustilo Anderson classification. You should know about this. Okay, may I guess there is some technical problem. Okay, yes, so this is your question and we'll discuss this after. Okay, so let's discuss this. A 15-year-old male with complaint of swelling over left shoulder, X-ray done revealing osteolytic lesion in epiphyseal region of the proximal humerus with stripped calcification. Surgeon recommended biopsy of the lesion post X-ray, while the pathologist has reported biopsy as mixture of fibrous matrix with scattered giant cells. The diagnosis is okay. So giant cells हैं and osteolytic lesion है. GCT yes हो बिल्कुल हो सकता है. Chondroblastoma yes. Fibrous dysplasia and chondromyxofibroma giant cells नहीं होते हैं. So read the question carefully. Giant cell इन दोनों में ही है, but this stripped calcification is not seen in case of GCT. Sorry, GCT में you will never have stripped calcification or the periosteal reaction. So the GCT is not the answer. The answer is your chondroblastoma. Okay, the answer is your chondroblastoma. Okay, हाँ ये बहुत इंपॉर्टेंट चीज़ है. यू शुड रिमेंबर दिस. जनरली यू गेट कंफ्यूज कि कौन सा कहाँ का है. तो रिमेंबर कि MNO. ओके, M फॉर मेटाफाइसिस, N से देर इज नो ट्यूमर, M के देन O. सो O से स्टार्ट होने वाले लाइक ऑस्टियोकॉन्ड्रोमा और द ऑस्टियोइड ऑस्टियोमा और द ऑस्टियोसार्कोमा, these all are from the metaphysis. whereas D for diaphysis, तो A B C D के बाद E आता है, so Ewing sarcoma and the enchondroma will be of the diaphysis, rest all will be of the epiphysis. Okay, especially the giant cell tumor, the chondrosarcoma etc. Giant cell tumor में एक peculiarity है that you should know, that's why you should read the question very carefully. Okay, so giant cell tumor arises from the metaphysis, and the most common site or extent is your epiphysis. And remember, giant cell tumors are seen only after the fusion of epiphysis. Remember this. This is very important. Okay, because bone tumors are very important. A question 110% in every examination you will get, and इसमें भी there are 90% chances कि इन्हीं तीन टॉपिक में से किसी एक पे क्वेश्चन होगा, either giant cell tumor or osteosarcoma or your Ewing's sarcoma. Okay, remember this. This is very important. Okay, so this is your giant cell tumor. So giant cell tumor, it is mostly seen in proximal tibia. Age अपन ने discuss करी ली. There will be giant cell in the histopathological slide. Proximal tibia followed by distal femur, and also X-ray के अंदर there will be soap bubble appearance, a characteristic lobulated appearance, eccentric in location, no calcification, no periosteal reaction, and very important, it is benign, but its characteristic feature is that it has high chances of recurrence. Okay, it has a high chances of recurrence. Okay, and the treatment depends on the site. Spine है तो radiotherapy है, distal ulna or proximal fibula है, which are not used for any functional involvement of the limb, so they will be only excision, whereas proximal tibia, distal end of the radius, the bones which are required for the functionality, there after the excision you have to go for the arthroplasty, and also you can go for the bone curettage, but uske baad you have to fill that gap with the bone cement first for the support. And very importantly, because of its heating mechanism, the residual small tissues or the residual benign tumor cells will get killed or get destroyed. Okay, this was about giant cell tumor. Okay, so एपीफाइजो मेटाफाइजल जंक्शन पे एक्सपेंसाइल होता है, इसेंट्रिकली लोकेटेड होता है, नॉट एट द सेंटर. ओके, this is your soap bubble appearance of the giant cell. Okay, this is your chondroblastoma. Epiphysis में होता है, there is no periosteal reaction, there will be central or stripped calcification. Okay, there is stripped calcification like this is your chondroblastoma. Okay, and resection with grafting, and there will be two characteristic features in the histopathological slides. First of all, ये जो calcification है, it looks like chicken wire, and secondly there will be scattered giant cells. Okay, the fibrous dysplasia में there will be monoostotic or polyostotic lesion like this. Okay, तो fibrous dysplasia सिंगल बोन में होता है, एंड मोनोऑस्टोटिक मीन्स सिंगल बोन. जॉज मोस्ट कॉमन साइट होती है यंग एडल्ट्स के अंदर, पेनलेस स्वेलिंग. whereas chondromyxoid fibroma metadiaphyseal junction पे generally in the phalanges, large lytic expansile lesion होता है, but it is solitary painful lesion. Okay, the treatment is resection or the curettage. Okay, now next question. So next question के लिए भी I am giving you 60 seconds, and then we'll discuss it अच्छे से. Read the question carefully and the options even more carefully. Okay, so let's discuss this. A 54-year-old female presents for evaluation of the left shoulder pain. She previously sustained a proximal humerus fracture 8 months prior and underwent surgical fixation. She complains of persistent fracture site pain, denies of any current numbness or tingling to the left hand or arm. Patient is left hand dominant and is the sole provider and caregiver to her elderly father. Shoulder motion is limited secondary to the pain. The patient has normal range of motion of the elbow and the wrist, neurovascularly intact. For management of this patient's non-union, here you can see that interlocking nail of the humerus has done, and here you can see that this is a case of non-union after Criff humerus nail. Now what will be your next management? Okay, so non-union है, so conservative नहीं रख सकते. Arthroplasty there is no need because the bony joint are normal. Revision intermedullary nail with bone graft, or this nail removal with ORIF with plate and with bone graft. So the treatment of choice will be second, that is your first you will remove the nail, reduce, fix the reduction by plating and with bone graft. This is your treatment of choice, and in most of the non-union you go for this only. Okay, or if plating with bone graft. Now bone graft lene ki most common or the best place is your iliac crest. Okay, remember iliac crest, or you can take it from the olecranon as well. Okay, so the best is your iliac crest. Okay, now we'll come to the next question. Next question is this, so I'll give you another 60 seconds for this question. Okay, now let's discuss. A 3-year-old female presents for OPD outpatient evaluation of her left elbow. The patient's family reports that she sustained a fall approximately 6 weeks ago. Since that time, she has had pain and decreased movement of the elbow, which prompted her to seek treatment today after 6 weeks. So negligent. Okay, and this is very common problem in a Indian society due to illiteracy, etc. Okay, so okay, we get patients after several weeks, especially children and the elderly ones, and doing unnecessary wrong treatment from the quacks, etc. Okay, so this makes our health system and the department needs to be more vigilant. That's why there is importance of doctors in a society. Okay, so there is, prior to today's evaluation, she has not been seen or examined for this injury. Motor intact and radial pulse palpable, no neurovascular injury. How will you manage this patient? So this is a old fracture of the this part. So this is your ulna, this is your radius, so this will be your lateral part. So fracture lateral condyle of humerus, and this is your old fracture. And 3-year-old female, so old fracture है, so close reduction internal fixation से काम नहीं चलेगा. You have to go for the ORIF with K wire. So the treatment of choice will be K wire with ORIF. Okay, so conservative you cannot do. Bicolumnar plating, no, it is done in adults. Tension bend wiring, it is done for the olecranon. So K wire, and that too ORIF with K wire. And why surgical treatment is necessary? Because it is near to the joint. So lateral condyle, medial condyle, supracondylar humerus fracture in children, you need to do a precise reduction, and you have to maintain it. That's why you have to maintain it with the KY, because the if reduction will get disturbed, there will be malunion leading to the deformity. So here malunited fracture of lateral condyle of humerus will lead to tardy ulnar nerve palsy. Okay, it will lead to tardy ulnar nerve palsy. Now you will say कि ulnar nerves तो medially होती है, so इसमें क्या होता है, due to malunited lateral condyle humerus fracture, there is stretching of this ulnar nerve, not compression. Whenever you do the flexion, extension, or pronation, supination, so that's why there is tardy ulnar nerve palsy. Whereas in fracture medial condyle humerus, there will be malunited के केस में cubitus varus deformity. Okay, and this is your cubitus valgus deformity, tardy ulnar nerve palsy in cubitus valgus deformity. Whereas in fracture supracondylar humerus, the most common complication is your malunited cubitus varus deformity, which is called as the gun stock deformity. Okay, remember this. Okay, and इन डिफॉर्मिटीज का करेक्शन में बेसिकली यू डोंट नीड टू करेक्ट देम, फिजियोथेरेपी एक्सेट्रा से ही काम चल जाता है, बिकॉज देयर विल बी नो लिम्पिंग एज इन केस ऑफ द लोअर लिम्ब. But if they are more intense, limiting the function, causing pain, etc., then you have to go for the surgeries, which are called as the osteotomies. And in gunstock deformity, you do the French osteotomy. Okay, in gunstock deformity, you do the French osteotomy. Okay, now we'll come to the next question, and here are your 60 seconds for this question. Okay, so there is a 5-year-old male, recent onset of limping while walking, limping of 5 days duration only, limited movement of both hips, x-rays and diagnosis. So here you can see there is some pathology here at the hip joint, and you cannot see the femoral head. Okay, femur head is not present, so there is avascular necrosis of the bilateral femur head in a 5-year-old child, and this is called as your Perthes disease or lag cavus Perthes disease. Okay, this is called as Perthes disease. So इसमें क्या होता है, there is decreased blood supply. So there is AVN, avascular necrosis of the femoral head, and the age group is less than 10 years old child, especially the boys. And but the good thing is that it is temporary. After some time, the blood supply is normal again. So the prognosis is very good. Prognosis is very good. You just have to prevent any pathological fracture or dislocation, वो ध्यान रखना होता है. And not to let the child walk बहुत ज़्यादा, so that there is no other injury. And the prognosis is very good. This is your Perthes disease or leg caval Hansen disease. Okay, here you can see. And after some time, when the blood supply is normal, the AVN जो होगा that would improve, and normal bone growth can occur. Okay, so this is your Perthes disease. Slipped capitofemoral epiphysis में क्या होगा, we have already seen. Osteopetrosis में there is marble disease where there will be sclerosis and increased whitish hue of the entire bones. And in osteopoikilocytosis there will be this strip type का calcification uh, at many places, intermittent like this is your osteopoikilocytosis. Okay, now we'll come to this question, and here are your 60 seconds for this question. Okay, so let's discuss 10-year-old man, male yani child. Patient presents with forearm pain after when he fell while walking in the schoolyard. No obvious deformity. Range of motion of elbow and wrist intact. Pain to palpation on mid forearm. Neurovascular intact. How would you manage this fracture? So this is fracture of both bone forearm, जिसमें this is your radius, this is your ulna. Radius is undisplaced, ulna is displaced thoda bahut, but the patient is child. Okay, so remodeling modeling is very good. So this type of displacement you can treat with the conservative. So these two are the conservative treatment. Now below elbow or above elbow, so remember in both bone forearm we go for the above elbow cast. So the answer is your above elbow cast, that is the conservative management. Okay, so the answer will be above elbow cast. So अब surgeries अपन ने देख ली. Now we will discuss the common casts which are used in different types of fracture. So humerus के ऊपर proximal humerus हो और shaft of humerus हो, you go for the U slab. Okay, U slab is nape of the neck say from laterally till here, crossing the elbow like this till here. This is a U slab. Or also for the distal 1/3 etc. you can go for the hanging cast also. मैं कभी slab बोल रहा हूँ कभी cast बोल रहा हूँ because क्या होता है just after the fracture, for the initial 7 days you put the slab, then you go for the casting. Okay, because first 7 days में swelling etc is very intense, so there would be high chances of compartment syndrome etc. So casting में you take a gap of 7 days, till 7 days you keep the limb in the slab. Okay, now in case of distal humerus or elbow or both bone forearm or individual forearm bones, nightstick fracture, Monteggia, Galeazzi, etc. In all these, you go for the above elbow cast or slab. Okay, in distal and radius fractures like the Smith fracture, Colles, Barton's, or the wrist injury, scaphoid, etc., you go for the below elbow cast or the slab. Okay, and for the hand injuries, जैसे metacarpal phalanges, you go for the cock up slab. And scaphoid के लिए and Colles के लिए you go for different types of cast. दोनों ही below elbow cast होते हैं and both palmar flexion में होते हैं, but Colles cast is ulnar deviation. You have to put the Colles cast in ulnar deviation, whereas in scaphoid you have the radial deviation, and also you cover the thumb pura in glass holding pattern. Okay, now in case of femur fracture, that is proximal neck IT, or the pelvic fractures or the shaft of femur fracture, you go for the traction. no cast. For the distal femur or any tibia or fibula, you go for the above knee cast. And for the ankle injuries like Pott's spine, a Pott's ankle, Cotton's ankle, okay, ankle injury or the tarsal injury or the base of the metatarsal, you go for the below knees cast. And for the toes you go for the chappal slab or the chappal cast. And specially एक special होता है for the patella. For patella you go for the cylindrical cast. You go for the cylindrical cast. And above elbow cast is in the 90 degrees like this, but only olecranon में it is semi flexed, whereas the above knee में 90 degree flexion नहीं होता knee joint पे, just 15 degree flexion at the knee joint पे you put the above knee cast. Okay, now this is the next question. So here are your 60 seconds. Okay, so let's discuss. A 87-year-old female, that is elderly female, after a fall down one step at home, fall was directly onto the left hip, and she reports isolated left hip and thigh pain. No other injuries. She denies of loss of consciousness, means there is no head injury. Lives independently and uses no assistive devices prior to the fall. A focused physical examination of the left lower extremity reveals deformity of the leg, including shortening and external rotation. Pain at the hip with any movement of the leg. No other injury. Sensation and motor are intact, and 2 plus pulses are present and neurovascularly intact. How would you manage this uh, fracture? Old age characteristic, IT, femur fracture. Okay, so you either go for the surgery में the surgery of choice is your proximal femur nailing, or you go for the conservative by the skin traction, or if plating you can do, but not the uh, first line or the treatment of choice. And arthroplasty, no, because the joint is still good and there is no pathology in the joint. तो अब इन दोनों में से चूज करना पड़े तो ऑलवेज गो फॉर द सर्जरी, दैट इज क्रिफ विथ proximal femur nailing, that is Criff with proximal femur nailing you should do, है ना? Because old age में at least 1 to 2 months of immobilization will have very bad side effects like stiffness, the pressure ulcers or the ulcers at the sacrum, okay, and sorry, high chances of DVT, etc. So एंड इमोबिलाइजेशन प्रोलॉन्ग्ड होगा, मोबिलाइजेशन नहीं कर पाएंगे, मसल वेस्टिंग एक्सेट्रा, तो बहुत सारे प्रॉब्लम्स है. दैट्स वाई द न्यूअर ट्रेंड एंड द बेटर ट्रेंड फॉर betterment for the patient also is go for the surgery. So the treatment of choice in IT femur fracture, even in undisplaced one, will be your CRIF with PFN, that is proximal femur nailing. Okay, now let us discuss the differences, very important, between neck of femur fracture and the IT, that is intertrochanteric femur fracture. So neck of femur fracture is your intracapsular fracture. Neck is inside the capsule of the hip joint. IT femur is your extracapsular fracture. Neck of femur fracture में what happens is that the signs and symptoms are both are common in the elderly population. So the signs and symptoms are less in neck of femur fracture as compared to IT femur, like pain, swelling, deformity, etc. Okay. Displacement, because it is intracapsular, so obviously displacement will be less, and यहाँ पे displacement will be more. Displacement will be less, displacement will be more. And here, very important thing about the neck of femur fracture is that it never unites. That why always surgical treatment is done, whereas in IT femur fracture is that fracture which always unite. So you can go for the conservative management, but the treatment of choice is PFN, that is surgery. Okay, अब यहाँ पे treatment of choice in young adults, as we have discussed earlier also, in young adults it is corticocancellous screw or the DHS, whereas in elderly population you have to go for the bipolar hemiarthroplasty. And what is the difference between hemiarthroplasty and complete arthroplasty or total hip replacement? In complete or total arthroplasty, that acetabulum cup or the acetabulum will also be changed. There will be prosthesis of acetabulum also, whereas in hemiarthroplasty only the head and the neck and the stem of the femur is changed. Okay, so this was this question. Now this is your next question, so I'll give you 30 seconds, only 30 seconds for this question. Okay, so a cricketer got injured while holding a catch, following which he complained of pain over the base of the thumb. Which structure is most likely diagnosis? So देखो base of the thumb पे holding a catch, so there will be forced abduction. Okay, forced abduction like this. So there will be fracture at the just base of the thumb here. Okay, and there will be injury to the ulnar collateral ligament. Okay, it is called as your Skyer's thumb or the gamekeeper's thumb. Skyer's thumb or the gamekeeper's thumb, ulnar collateral ligament, first metacarpal base. Okay, over the base of the thumb. So this is your ulnar collateral ligament की वजह से there will be injury, and it is called as your Skyer's thumb or the gamekeeper's thumb. Torn ulnar collateral ligament here at the metacarpophalangeal joint. Okay, तो metacarpophalangeal joint पे होता है, and this is your metacarpal. Okay, so ppx का base here. Now next question. A young male of after sudden unconsciousness following an episode of seizure on awakening finds that both of his arms are adducted or internally rotated. The most probable diagnosis. Here are your 30 seconds. Okay, episode of seizure है, both arms were adducted and internally rotated, means dislocation of the shoulder. And दो तरीके से आप इसका आंसर निकाल सकते हो. सीजर में भी posterior dislocation most common है, and in posterior dislocation also you will have the attitude of adduction and internal rotation. So this is your posterior dislocation of the shoulder joint. Whereas most common overall is your anterior dislocation, उसमें भी subcoracoid type का. And in case of seizures or the epilepsy or the electric shock, in all these cases the most common cause is dislocation is a posterior dislocation. और anterior dislocation में क्या होगा, you will have attitude of external rotation, abduction, Dugas test, and this loss of the contour, Hamilton ruler test. ये सारे shoulder dislocation होता है. The treatment of choices reduction and following it in the maintenance by the use lab. Okay, and reduction can अच्छे से हो जाता है. In case of recurrent or habitual shoulder dislocation, there can be rounding off and you need the surgery, and very rarely there can be Banker's or the Hill-Sachs lesion also. So here the treatment is your sorry, the diagnosis is your posterior dislocation. Okay, and in posterior dislocation you have this electric bulb sign. This is your electric bulb sign. You will see in AP view, this is your head of the femur, posteriorly dislocated, and this is your empty glenoid sign and the electric bulb sign. Okay, and empty glenoid sign and the electric bulb sign. And there is one inferior dislocation of the shoulder joint, and इसको नाम से बोलते हैं luxatio erecta. तो just remember this, luxatio erecta, and it is subglenoid. मोस्ट कॉमन नर्व किसी भी शोल्डर डिसलोकेशन में जो इंजर्ड होती है, दैट इज एक्सिलरी नर्व which affects the deltoid. So deltoid paralysis with regimental badge sign. Okay, now next question. A 7-year-old child presents with fever, tibial swelling, exhibits on X-ray periosteal reaction. Laboratory shows raised ESR and TLC. Next step in diagnosis of the patient. So here are your 30 seconds for this question. Very easy. Okay, so very easy. There is an infective pathology, and mostly अभी joint involved नहीं हुआ है, fever है, periosteal reaction, TLC बच्चा. So it is acute osteomyelitis. क्रॉनिक क्यों नहीं है, बिकॉज क्रॉनिक में क्लोएका एंड ऑल होता है इन एक्सरे इन्वॉल्यूक्रम, दी क्लोएका इन्वॉल्यूक्रम एंड दी सीक्वेस्ट्रम. सो नेक्स्ट स्टेप एमआरआई और पस कल्चर, ये नहीं, इन दोनों में से भी यू प्रिफर दी एमआरआई, बिकॉज बिफोर ड्रेनिंग द पस यू शुड नो कि यस पस किस किस डायरेक्शन में है. और इवन यू हैव टू डिफरेंशिएट बिटवीन द इन्फेक्टिव पैथोलॉजी एंड द aggressive tumor like even sarcoma वगैरह sometimes presents with fever, periosteal reaction, बिल्कुल एक acute osteomyelitis जैसा. So the treatment of choice here will be MRI. Okay, the treatment of choice here will be your MRI. So all this was all about for today's lecture. Thanks for watching my lecture. If you like the lecture, please like, share, and subscribe, and also see my other lectures on the YouTube and the special class. For subscribing for any of the subscription plans or for logging into the mobile application for special class, you can use the code that is Anshul B10. Okay, while subscribing for paid subscription plans, you will get extra 10% off by using this. Okay, so study hard, study well, take care of yourself. If you have any doubts, you can contact me and solve your doubts in the live chat box of any of my YouTube or the special classes. Okay, so bye bye.